introduce yourself.
Good afternoon. My name is Paul Tiwana. I'm the Division Chair of Oral and Maxillofacial Surgery at the College of Dentistry at the OU Health Sciences campus here in Oklahoma City.
Tell me, what does oral and maxillofacial surgery mean?
Oral and maxillofacial surgery is a specialty of dentistry that encompasses the surgical management of hard and soft tissues of the facial regions.
Okay, so what are we here to talk about today? Evidently, the American Dental Association is responding to something the WHO has said.
So just recently, the WHO, or the World Health Organization, in their collaborative group of dentistry, issued some interim guidance, not guidelines, but guidance regarding the practice of dentistry from their perspective.
Okay, and what were those guidelines?
The guidelines specifically represent concern that they have over the practice of dentistry where you have aerosolization procedures. And for the average person, that includes just the use of a handpiece or a drill, typically seen when you practice or visit at a dentist's office.
Okay, and so the American Dental Association and the practitioners at the OU College of Dentistry are responding that this is not necessarily as great a concern as the WHO is saying.
I think that's exactly correct. And this is not only affecting dental practices here in the United States and the practice of dentistry in the United States, but there's been a significant amount of confusion about this on a worldwide basis. And really, when you look at the WHO's guidelines, what they're really talking about are potentially restricting those procedures in areas where there is rampant spread of COVID-19 or SARS-CoV-2. And they really are relegating it to the management based on local health authorities. So in that case, it would be the Oklahoma Department of Health, obviously, our Board of Dentistry, and so on, in terms of the regulation of when to implement guidelines like that or not. The American Dental Association, as well as the Oklahoma Dental Association and the World Dental Federation, have been critical of this because they're looking at it from the perspective of the fact that, it's created some confusion relative to the implementation of those guidelines from the WHO.
Well, and so when COVID first hit, I know in Oklahoma especially, that's all I know, but the College of Dentistry took some serious precautions. I mean, you weren't seeing patients, you were getting to know the situation and finding ways that you could make this a more healthy experience for everybody involved.
Yes, and Dean Colmia, the faculty, the staff, everybody really poured their hearts into trying to make sure we created a safe environment. Not only that, almost every single dental practice in the United States was closed for a period of months. And this was done in order to better understand the virus and its impact on dentistry and how we might be able to safely begin practicing dentistry again for our patients.
So now that you are practicing again, are we at full capacity on seeing patients? Or?
That's a great question. So at the OU College of Dentistry, we're not entirely at 100% capacity. And the reason for that is to appropriately put in social distancing, to try to allow for times to be able to clean after patients are there, before and afterwards, as well as regulate the number of patients that are coming into the building, how often and for what purpose.
Okay. So how important is routine dental care? I mean, obviously I think our viewers would understand, well, if you've got a dental emergency, we need you to be open, but how does that relate to the emergent kind of situations?
That's another great question, and I think an area where we as healthcare practitioners are very importantly concerned about the WHO's recommendations. Obviously, a straightforward cavity, may not be an issue immediately, but if you delay that care 6 months, 12 months, it can become a serious dental emergency, and in some cases require hospitalization. Not only that, when the patients are finally able to access dental care, not only is it a more invasive procedure in order to take care of the problem, but it's also more expensive. So, from our perspective, managing this is a critical portion of preventing those kinds of diseases from continuing and causing more trouble for patients.
So it's not really even just a dental situation. Your dental care can affect your body as a whole, right?
There's been a number of really strongly made links between dental care, dental health, and of course the rest of your systemic health. And that includes everything from low birth weight babies to the issues associated with diabetes and chronic health conditions.
So in a time where we all want to stay as healthy as we can because there's a huge pandemic going on, this is a key part of that whole general health system that we need to take care of ourselves.
Exactly. You know, routine dental care is critically important to maintaining healthy oral tissues and structure and teeth. And what may not be noticeable to a patient now, but immediately diagnosable by your dental care professional or dentist, could, if you're not seen on a regular basis, turn into something more significant down the line. And we think it's important for patients to be able to access routine dental care as they need to.
When they talked about aerosolizing procedures, you touched on a little bit what that means. Can you go into that a little bit more detail? What kind of procedures are those?
So those are procedures that usually involve a drill, or sometimes we'll call it a handpiece. And for most patients, that's what they associate visiting the dentist with, the sound of that drill. But you know, the drill as it's working creates a small area of particles, and those particles include bits of the teeth. They also include the saliva and other tissues that are there, in addition to removing and taking care of the tooth structure that happens to be there, or the bone, as the case may be. And as that goes forward, the concern has been that it will create a cloud of aerosolization that will affect other patients and healthcare providers as they're undergoing dental treatment. We've looked at this very extensively, and we're continuing our work on this, including studies to look at exactly how the droplets are spread, how far they're spread, and by what mechanism they're spread. So at the OU College of Dentistry, we're being very proactive in the profession to try to minimize those as being an issue. The other thing that's very important to mention to patients is that all patients are given an oral rinse before they're seated. Everybody's screened at the door before they can even access treatment. And then once they're in the chair, we isolate their oral cavity, their mouth, their nose as much as possible to minimize any of those issues going forward. And we use very high-speed suction in order to evacuate those particles and that aerosolization as much as we possibly can. We do everything, including looking at the filtration systems of the building, to the filters we have, to how often the room air turns over, in order to try to ensure that we provide the best and safest patient care experience as possible. And I know all dentists in the community are going through doing those same procedures to keep their patients healthy as well.
So on the provider's part, you are in full PPE, and so which obviously is protecting you and the other people that are caring for these patients, but also I would guess you're doing your part to help protect them from any other aerosolization from just you.
Absolutely. No, we are absolutely doing that. And you know, we're very careful. The Centers for Disease Control released some guidelines, which we're following. And all dentists are following relative to the management of patients undergoing active dental treatment, and for our ancillary dental personnel who are assisting with that treatment.
I understand that you are seeing some patients for follow-up care via telemedicine. How does that work?
As we can, certain specialties, like myself in oral and maxillofacial surgery, where we're following patients with traumatic facial injuries or post-operative care from reconstructive operations, those are a little bit easier for us to be able to access and talk to patients about. Certainly that includes children with cleft lip and palate or other craniofacial anomalies as well. So not all of our follow-up care is done that way. It just depends on the severity of the situation and whether we can reduce that patient's visit to an online consultation if we can effectively get the information that we need.
So what has the dentistry profession learned during the pandemic that will help the future of dentistry? That's a big question.
So, you know, like medicine around the world, dentistry is also affected by so many of these different things that confront us. Confrontation sparks, you know, an inward-looking response and then change eventually. Back in the 1950s, dentists didn't used to wear gloves or masks, and that's obviously changed. And the most recent crisis was HIV or AIDS. Obviously, at that time, for dentists, that was a very scary time, as well as obviously for patients. But it sparked changes in the profession, such as mandatory glove wearing, mask wearing, eye protection, and so on, in order to try to reduce those risks, not only for patients, but also for dental care professionals.
Well, it looks like we actually have covered everything that we had planned on discussing. Is there a time that it's okay to put off dental care, or is it just really not worth the risk for your health, for your kids' health, for?
My recommendation is that all patients visit their dentist for their annual or semi-annual checkups, as indicated, and for these exact same reasons. The idea that something that can be caught, which is small and incidental, could turn into something more serious down the line, I think is an important thing to leave for patients, so that they understand that they should try to see their dentist as regularly as they are instructed to do so by their dental offices.
Why do we think that? What was the WHO's reason for? Obviously they're looking at pandemic from a big scale, but surely they also realize that the medical health values to not putting off the dental care.
In fact, if you carefully review the WHO website, even they themselves under oral health care describe the importance of preventive dental care. And so I think they realize how important it is. It's I think, in response to this pandemic, that they are concerned. And the other, I think, perhaps very important thing to understand is that, on a worldwide basis, there are multiple levels by which practitioners practice dentistry or medicine or whatever particular healthcare field they're in. And what may seem not as important in the United States relative to the WHO's recommendation may be more so in a country that does not have institutions like the CDC or the American Dental Association or the Oklahoma Dental Association.
And so is there anything new that the CDC has come out about dental care at all in the last?
Their recommendations are similar to anybody who's undergoing a surgical procedure relative to PPE that's appropriate. Obviously, contacting the patient ahead of time, testing them if needed for certain procedures, and then making sure that we have all of the appropriate guidance in place.
Excellent. Anything else?
No, that's everything, unless you have anything else for me.